Good evening, everyone. I am RCDSO Registrar and CEO Dan Faulkner, and with me is RCDSO President Dr. Sandy Venditti. Welcome to this first edition of what we are calling the RCDSO Connect. Our aim is to help you keep up with new information from the college and to hear from you directly about any questions that you might have.
So to begin, as RCDSO President, I would like to recognize the complexity and privilege of gathering online today by sharing a digital land acknowledgement adapted from Adrian Wong of Spiderweb Show in Ontario. Since our activities are shared digitally to the internet, let us take a moment to acknowledge the legacy of colonization embedded within the technologies, structures, and ways of thinking we use every day. We are using equipment and high-speed internet not readily available in many Indigenous and marginalized communities. We invite you to join in acknowledging our shared responsibility to make good use of this time and for each of us to consider our roles in reconciliation, decolonization, and allyship. Thank you.
I'm really happy to say that many of you responded to our request for questions in advance. Sandy and I will try to answer many of those in the next hour. And you should know that we are recording this session and it will be posted on our YouTube channel. So we hope to answer as many of your questions as possible this evening. But to get started, we'd like to ask you a question. We're going to be polling you on a number of issues this evening. And we wanted to start by asking you, in one or two words, how do you feel the COVID-19 pandemic has impacted dentistry? So what we're going to be using throughout the presentation is a simple tool called Slido, and that allows you to easily express your opinion by participating in live polls. On your device, your smartphone, your computer, or your tablet, open your web browser, and I'm giving you an opportunity to do that as I'm speaking, and go to www.slido.com and enter the event code 426071. You can also scan the QR code that you see on the screen using your camera on your smartphone. And you can now participate in our live polls by selecting your desired answer. So we're going to give you a few seconds to do that. And a word cloud will start to form on the screen as you enter in your one or two words on how do you feel the COVID-19 pandemic has impacted dentistry. So what we'll see
Dan, you're on mute.
So what we'll see here are a number of words that are forming. They will become bigger and smaller depending on the number of people who are saying something very similar. And we can see negatively, stressful. I saw profoundly earlier, exhausting, cost increases. So some really interesting ways in which you're identifying how the pandemic has impacted you, your practice, your staff. That's great, thank you. So we will be keeping track of the word cloud. It will stay with us and we'll be able to obviously use that and share any information that will be helpful. Sandy, over to you.
Thank you, Dan. So Dan and I wanted to pass along a few highlights from the November Council meeting. As always, there was a packed agenda. Council approved an operating budget for 2022 with a projected deficit of about $730,000. As in the previous 4 years, the college's overall deficit is again driven by loss provisions for the professional liability program. In other words, amounts that must be accounted for claims. The amount is determined by actuarial assessment. The loss provision had to be increased by almost $2 million for the coming year to $6 million. More information will continue to be available to the profession, but generally the loss provisions indicate changes in number and dollar amount of claims against dentists. In addition, more money has been allotted to deal with the backlog of complaints. Staff and the committee have been working hard to decrease the number of cases started in 2017, 2018, and 2019. We only have 61 files left from those years, and that's an 85% reduction over the past year. We will reduce this backlog and cut the length of time to process most complaints, but this requires more resources for 2022. Costs in this area should stabilize once the backlog is cleared and if the volume stays relatively constant. For the past 5 years, our biggest area of cost growth has been PLP. And notwithstanding fee increases in the past 3 years, external forces continue to contribute to underfunding of PLP. Council has asked staff to look into the financial alternatives for PLP, but it is likely that a fee increase will be required in fall 2022, and it will be related almost exclusively to PLP, not regulatory expectations. This is not unlike many insurance experiences that we all have in our own personal and professional lives. Council continues to see access to care as a key strategic priority for the college. Information collected through the annual renewal questionnaire and the efforts of the Patient Relations Committee will help to find opportunities to share information with the public and propose concrete action the RCDSO can take to advance access to care. Along those lines, we are also focusing on professionalism. The college will strike a working group to explore professionalism issues with the ultimate goal of developing a good practice document articulating the principles, values, and duties of professionalism. As I have emphasized throughout my term as president, council's job is governance. Our 25-member council, made up of public and professional members, has a duty to provide high-level strategic oversight of the RCDSO, whose mandate is to protect the public. We do not get involved in the operations of the college. And as elected members, we do not represent the interests of our districts. Our decisions must always be made in the public interest. Governance is top of mind with the government as well. It's clear the government of Ontario wants evidence that all regulated health colleges are doing their jobs properly. Last year, the government launched the first College Performance Measurement Framework, or CPMF, for all 26 health colleges. It's a tool to measure each college's effectiveness, including the effectiveness of their council, the way council members are trained, the quality of their decision-making processes, transparency, diversity and inclusion mechanisms, and a lot more. The reports are public, and you can see our 2020 report on our website. And we are gearing up now to report on 2021. Although the RCDSO was praised for a number of our processes, in the last report, we have areas that need attention, and we are on it. Here are a few examples of what is on our list. Competency-based elections and appointments. We are already leading the way in this area, but more work is underway. Our current council eligibility course is being revised and improved. We are continually reinforcing the fiduciary duty of council, the duty to always act in the public interest. We are working on a new performance evaluation system for council members and committee chairs to increase our effectiveness as a council in making informed decisions. And we are making sure our council agendas address our strategic priorities, public interest issues, and include educational sessions for better decision-making. We are also embracing equity, diversity, and inclusion. Our demonstration of equity and diversity is essential for better governance, management, and operations. Our profession, council, and staff are a diverse representation of our population in many areas, including ethnic, cultural, gender, and sexual identity. But we can do better. We know that meeting the needs and respecting the views of every community in our province is essential. In order to do that, we need a diverse board with multiple perspectives. That can be tricky. Some groups might not normally seek these positions or even be aware that they exist. That simply means the duty is on us to educate, work harder to eliminate barriers, and reach out to encourage all members of the profession to consider and understand the value of serving as a council or committee member.
One final update relates to the annual renewal process and specifically the survey that accompanies that renewal process. I know that many of you have already renewed, and I want to remind all of you that there is an upcoming deadline of December 15th. But I have been asked in various places why the annual survey is more detailed this year. The annual survey consists of 3 different types of information. First are questions that relate to our legislative obligation to collect certain types of information. So that might include things like any criminal charges or whether you have a license in another jurisdiction. The second type of information is information that the Government of Ontario requires in order to populate the provincial health practitioners database. And the third relates to questions that help us better understand the nature of your practice. There's many different types of practices, probably as many as there are dentists. There are generalists and specialists. All of you have different types of patients that you would see. You work different hours. You have different commitments to clinical practice versus teaching or research or administrative practices and many others. Understanding the profession has many purposes, including programs that we as a college might consider developing, understanding practice characteristics that contribute to good quality of care, and how we can responsibly contribute by sharing this data for system policy and decision making. And we do that in a very responsible way with a unique data set that no one else has. And I talked recently at the ODA General Council meeting about dentist supply and how our data can support and contribute to decision making because it is a part of the data that is necessary. In 2022, the college will report back to you on the current state of dentistry based on your answers. I want to thank all of you for your cooperation, and we'll ensure that we share more information about this direction as we move forward so that you understand how it will be used and what we will collect in the future. And with that in mind, we have another poll question for you. So if you refer to the chat, you will see instructions. There's a slide up as well on how to answer the poll question on the screen, which is, what's your preferred source of college news, updates, and reminders? So we'll give all of you some time to answer, and we'll watch some of the numbers as they emerge. See about 73 have responded, and the vast majority are looking to college emails and e-blasts as a preferred source. Just give it another few seconds. So again, we'll be able to keep this data as you've responded. We can see at this moment about 88% through emails and e-blasts. Thank you very much. That's very helpful information for us. COVID-19 guidance has been the top of our to-do list for almost 2 years now. It's hard to imagine that it's been 2 years. As various levels of the government have made decisions, we have responded as quickly as possible. And for a while, I know it seemed like the decisions were made exclusively at 5:30 p.m. on Friday evenings, and we certainly tried to avoid that as much as possible. But we always tried to make sure that we had accurate information, not only relying on press conferences, but making sure that we had documentation from the government about any announcements that were made. We continue to monitor the current environment, including the new Omicron variant, which is very recently emerged. Our job, as you know, is to keep patients, the profession, and your staff safe. We understand, we want to understand what the evidence is telling us to do, and we want to be able to translate any new evidence into risk-based recommendations where that's possible. College staff have worked hard over the past couple of years throughout to keep the guidance current and clear. And I'm happy tonight to introduce our senior policy analyst, Cameron Thompson, and Dr. Michael Gardner, who's our Director of Quality Assurance, and they'll give you an update on some of the recent and ongoing work with respect to the COVID-19 guidance document.
Thanks so much, Dan, and hi, everyone. If you'll all just bear with me a second, I'm just going to share my screen and put some slides up. So hopefully someone will jump in if I accidentally mute myself or the slides aren't presenting. So thanks again, Dan, for the introduction. It's really a pleasure to be able to talk to everyone here tonight. As Dan said, I've been asked to talk briefly about our COVID-19 guidance for in-person care, which I'll be doing on behalf of myself and Dr. Gardner. Before getting into the presentation, I thought it would be worthwhile to sort of quickly introduce myself. My name, as you've heard, is Cameron Thompson. I'm the Senior Policy Analyst here at the college. I've been working in policy for more than 10 years, but I started my position here at RCDSO early last year, just at the beginning of the pandemic, in fact, and really only a few days before our office closed for in-person work. So you can probably imagine my focus since day one has really been on COVID and our COVID-19 guidance document. Dr. Gardner, as you've heard, is our Director of Quality Assurance. More than 20 years of experience here at the college, and he's been especially instrumental in ensuring that our guidance is evidence-based and that it's rooted in the realities of clinical practice faced by dentists like yourselves. And I think we could see from that word cloud exercise we did at the beginning of this talk that it's been a challenge for dentists in practice. And lastly, just so as not to be remiss, while Dr. Gardner and I are speaking tonight about our COVID guidance, we're really speaking on behalf of a much broader group of college staff dentists, external experts who have all worked really hard to develop our guidance and try our best to keep it up to date and working in the public interest. So just to keep us organized, this is an outline of what I plan to cover in the next 20 minutes or so. Now we'll start with an overview of our current guidance document, including a brief sort of recap of its history. I'll walk you through some of the key considerations or the key inputs that have influenced and informed and really in some cases determined the positions that we've adopted in our guidance document. I'll provide a brief jurisdictional comparison just to give you a sense of what our guidance looks like relative to the guidance of other dental regulators across Canada. I have some questions that I'd like to ask all of you, asking you to think about and tell us about the impact of COVID on your practices and what we might expect or what you might expect for the future of the profession and, in a sense, our guidance as well. And lastly, I'll provide some really sort of high-level concluding remarks. Before moving on, I just want to reflect the fact I know that many of you provided questions in advance of this session that relate to our COVID guidance. So, for example, common questions that that I saw, what is the evidence or the basis for the specific provisions that you struck in your guidance? Why does Ontario's guidance differ from other jurisdictions across Canada? When can we expect precautions for the provision of in-person care to begin easing? I'm not going to be able to address most of these questions directly, sort of in the interest of time, but I think you'll see that a lot of them will be answered indirectly as I go through the presentation and as I describe sort of where our guidance has come from, where it is now, and where we anticipate it's going in the future. So this is our guidance document for in-person care. I'm not planning to go through the provisions of our guidance in detail. I expect that everyone in this session is probably pretty familiar with them. Essentially, the document sets out infection prevention and control requirements for the provision of in-person care that are specific to the COVID-19 pandemic or responsive to the pandemic. Some of the key areas of focus in the guidance document are the screening requirements for patients, the enhanced PPE precautions, and a number of new precautions related to the performance of aerosol generating procedures, including presently a requirement that AGPs be performed only in an enclosed operatory and that fallow times be observed that achieve 99% removal of airborne contaminants based on air changes per hour. So this version that's up on the screen is, I think, the first version of the guidance document that was released in May of 2020. So just at the beginning of the pandemic. Since then, it's been updated a number of times. I think there have been 4 or 5 formal updates to our guidance, but what feels like countless additional housekeeping updates that were intended to tweak minor provisions or add sort of revised supplementary content. There have even been a number of drafts that really were worked up to the point of completion, but had to be sort of abandoned because the environment changed unexpectedly or public health restrictions shifted on us, which is sort of a recurring theme, which you'll hear a bit more about. Hopefully you're also aware that there are a number of important companion pieces that expand on our guidance for dentists. Presently, we set out additional guidance related to the use of teledentistry during the pandemic, guidance for antigen point of care testing, guidance related to vaccination, which includes a strong recommendation that dentists be fully vaccinated against COVID-19, along with I think a pretty comprehensive FAQ. All of these supplementary materials are updated as needed, some more frequently than others. The FAQ in particular, I think, is updated pretty regularly. They're all available on the members page of the RCDSO website. And it's really all of this content taken together that sets out a full picture of the college's guidance for in-person care, but the essential provisions, so the key requirements that members must meet in order to meet the standards set by the college, are set out in the guidance document. So I've taken this line graph from the dashboard of the Ontario Medical Association, which is really a useful resource if some of you haven't looked at it before. So this graph represents daily case counts for COVID over the course of the pandemic. And I thought it might be interesting to map some of our major guidance updates onto this graph. So our first complete guidance document was released in May of 2020 in the midst of I guess, the first wave of COVID-19. Our next major update was in the summer of 2020. This was done at a time when sort of community transmission was low, but Public Health Ontario had just released updated guidance, some of which was specific to risks and best practices in dental settings. And so our guidance was updated to reflect this. The next major update occurred in January of 2021. This was in response to, I guess, the second wave of COVID-19. It was at this point that we introduced what we've been calling enhanced precautions, which include, sort of as an important example, the requirement to perform all AGPs in enclosed operatories. And you can see from this timeline that the enhanced precautions were then kept in place as we went through the third wave in April and May. In the summer, we engaged in a collaboration with Ontario's other oral health regulatory colleges, the College of Dental Hygienists of Ontario, the College of Dental Technologists of Ontario, and the College of Denturists of Ontario, to align our guidance, which is something I'll be talking a little bit more about in a bit, and I think Dr. Venditti will as well. So we released a revised guidance document in July of 2021. At that point, we didn't roll back the majority of enhanced precautions. We did modify some provisions, but our priority at that point was achieving alignment with the guidance of the other oral health professions for a variety of important reasons. And this more or less brings us up to the present moment. Work is currently underway on potential future revisions, and I'll talk more about those a little bit later in the presentation. I will add one sort of final reminder just for emphasis, which is simply that, as I've said previously, the milestones captured here don't reflect all of the work that's been undertaken related to our COVID-19 guidance. It really isn't just for guidance updates. Really, this hardly scratches the surface when you think about, housekeeping updates and updates to our FAQ and other types of communications that have really been ongoing throughout the pandemic. So at this point, I'd like to talk a little bit about the considerations or the variables that informed our guidance. And this really answers, I think, one of the big questions that emerged ahead of this session, which is sort of some version of, what was the basis for this requirement, or what was the basis for this piece of guidance? Lots of questions about evidence. And unfortunately, I won't be able to get down to that level of granularity concerning individual provisions, but I can paint a broader picture of the types of variables that factor into our process, which will hopefully answer some questions. So this slide reflects my effort to highlight some of the key variables, the key considerations, and the inputs that inform our guidance. Some of these variables inform our approach, and some can really determine it. Another way of saying that is that in many cases, we have discretion to propose or adopt positions that in our view are supported by our analysis. In other cases, we may be limited in our options. For instance, if there's sort of applicable legislation that would govern what we might say, or if there's a new medical directive, which has been the case in the past, we have to ensure alignment with any guidance that we propose. So I'm going to go through each of these relatively briefly, but I hope that the overall impression that this gives is that there's really an enormous amount of work and analysis and engagement that goes on in the back end to produce our guidance. Firstly, there's the research and analysis, and this includes a review of the available clinical data, practice guidelines. It includes the legal analysis and jurisdictional comparison, a huge spectrum of sources to help inform our thinking. A real challenge in developing new guidance during the COVID-19 pandemic is that in many cases, the empirical evidence is not as strong or as clear as we would want it to be. So for instance, 2 published papers on the same subject might produce different results. 2 experts reading the same paper might reach different conclusions. Our understanding of the virus and the risk is often evolving. And in the case of sort of responding to the COVID pandemic, we're sometimes left in the position of making judgment calls on the basis of the available evidence and guided by our regulatory mandate, which first and foremost is to serve the public interest. Next, we need to be not only mindful of, but also compliant with the direction of public health authorities. We monitor new developments and new guidance from Public Health Ontario. We align ourselves with the medical directives of the Chief Medical Officer of Health, even shifts in the province's approach to public health restrictions. And we've seen the government change course a number of times over the course of this pandemic in terms of their approach to public health restrictions can really impact our approach to our guidance and what we're able to say. As much as it's possible to do so, we aim to test our draft guidance through expert consultation. We have undertaken formal consultation with external experts at several points during this pandemic. We also often reach out less formally with questions and to solicit feedback in between formal consultation periods. So in addition to our own staff dentists, we've engaged directly with infectious disease specialists, epidemiologists, representatives from Ontario's dental faculties, staff at Public Health Ontario, the Provincial Infectious Diseases Advisory Committee, among others. This type of engagement is really crucial. We really rely on these experts to test our thinking, to test our analysis, and ultimately to test any guidance that we're proposing. I'm only going to mention briefly our oral health working group, as I think Dr. Vindi is going to talk a little bit more about this. But a major contributor to our current COVID-19 guidance has been our collaboration with Ontario's other oral health regulatory colleges, which really began in earnest this past summer. And I think it sort of set a new benchmark for the oral health professions in Ontario. Member feedback is very important. For those of you who submit feedback, we definitely listen and we try to be as responsive as we can be. And lastly, RCDSO's council. and sometimes the executive committee acting on behalf of council are major contributors. RCDSO guidance only ever comes into effect following a careful review and vetting by the college's executive committee, who flag, crucial questions, provide feedback to help refine and finalize our guidance. And all guidance ultimately requires final approval before it can come into effect. And I guess as a kind of final thought on this slide, balancing all of these inputs, some of which are competing and some of which are ultimately contradictory in a sense, is a challenge. A balance needs to be struck because an overcautious approach risks burdening dentists and limiting access to care, which ultimately has the effect of risking harm to patients. That's something we understand and have heard very clearly from our members, while insufficient precautions obviously create a risk, that the practice of dentistry could be contributing to infections. But given that the priority is patient safety and public protection, I do think it's worth emphasizing that to our knowledge, we're not aware of any known instances of transmission occurring in the course of providing dental care in Ontario, either patient to staff or staff to patient, which maybe is an indication that the precautions are on the right track. I'm only going to touch briefly on our jurisdictional comparison because, this is a question that was submitted by a number of you ahead of this session. Basically, the question was, why don't the provincial guidelines line up with one another? And in particular, why are some guidelines so much stronger than others? As I mentioned in the last section, jurisdictional comparison is actually a big part of the research that we undertake when developing new positions or when we're evaluating our existing guidance. So we look not only at Canada's dental regulatory colleges and associations, but actually the other oral health professions as well. And for the purposes of our COVID guidance specifically, we did our best, as an example, to take a look at the guidance of the oral hygiene colleges, since dentists and hygienes are working closely together in practice. And prior to July of this year, RCDSO and CDHO's guidance were not completely aligned. In a nutshell, sort of summarizing our jurisdictional comparison, this won't come as a surprise, but when looking across jurisdiction, there's variance in the guidance across Canada between the oral health colleges and professions. There even seems to be a bit of a regional difference when you look sort of at Western provinces and compare them to Eastern provinces. There are some reasons why this could be the case. Stopping short of speculation, especially when looking across provinces. I mean, a couple of examples is that each regulator needs to be responsive to their local epidemiology. And as I've explained, each college has to be responsive to the direction of the local, provincial, and territorial governments, as well as their own public health authorities, which are not always aligned with one another and do not always come to the same conclusions concerning risks and appropriate mitigation strategies. But when looking at our guidance specifically, it's not easy to summarize without going provision by provision. Basically, we're roughly aligned in some cases with the majority of other colleges. So for instance, our requirements around the use of personal protection equipment are roughly similar across jurisdictions. Well, in other areas, there can be pretty substantial variation. So one example that comes to mind is our requirements around enclosed operatories and fallow times. We not only address these issues, but have fairly strong positions on them, while other provincial regulators don't address these topics at all. So there can be some significant variation between jurisdictions, and it's not always obvious why that would be the case. My personal observation is that in some ways this variation could grow. There are some jurisdictions that already appear to be starting discussions about reverting back to their original pre-COVID infection control standards. But I would suggest with the emergence of new variants and other shifts in sort of the public health indicators, I don't know whether these discussions are continuing or not. So at this point, I'm going to stop talking for a minute, and I'd like to hear from all of you. I have a few questions that I'd like to ask to get your perspective on how COVID's impacted your practice and get a sense of what could be next for dentistry. I'm going to ask 3 questions, and for each one, I think in the interest of time, I'll give you sort of 30 to 45 seconds to respond, and then we'll move on. So we'll see if this works. So first question, do you agree or disagree with the following statement? Patients who are fully vaccinated against COVID-19 and who screen negative on the date of their appointment should be able to receive care using reduced precautions compared to other patients. And sorry to sit here quietly, but I'll give you 30 seconds or so to respond. So it's interesting. It's interesting to see such an even split between the strongly agree and somewhat agree. I'd be interested in sort of probing further what those in the somewhat, like what that difference is. That might be something for sort of future consultation, but that's very interesting. Thanks. And apologies to anyone whose response I might cut off as I move to the next question. So do you agree or disagree with the following statement? Some enhanced precautions for dentistry should remain in place permanently in recognition that future pandemics are always a possibility. So for instance, maintaining some enclosed operatories. This is interesting. It's interesting to see so many in the strongly agree category. I know I haven't heard from all of you. This is very interesting. I'm going to move on to the next question, but thanks so much. So for the final question, post-COVID-19, which sort of enhanced precautions do you intend to keep in place, if any? And this is a check all that apply type question. So you should have that option to check multiple choices if that reflects your opinion. This is very interesting. I'm going to let this one go a little bit longer. I'm very interested in getting as many responses as we can. Well, I mean, this is very interesting. It's interesting to see so many of you anticipating what could be sort of permanent changes to the way that you practice moving forward, which actually leads sort of nicely into the next section of the presentation. And again, apologies for those of you still responding, which is sort of looking ahead, because I think some of those responses there sort of tie in some respects with what I anticipate being sort of next steps for our guidance. So thinking about what could be next for RCDSO's guidance, and this I think really is the main question that came out ahead of the session, sort of different versions of, when can we expect an update to RCDSO's guidance? In some cases, when can we expect precautions to be reduced? So first, I think I would say that in some sense, the college's guidance is always under consideration, whether sort of a formal review is underway or not. We're constantly monitoring the changing landscape and new data, which could impact or change our approach. In terms of when precautions could be reduced, it really depends, as unsatisfying as that might sound, on the environment. I think the sort of million-dollar question is, when will public health measures have improved sufficiently that precautions can be reduced safely? And this is a question really where you would get a different answer depending on who you might ask. So this is something we're actively considering. When is that time? What does it look like? As I think all the health regulators are across the spectrum. In terms of what we're presently considering as potential areas for future revisions, they're listed here on the slide, and I don't think that they'll come as a surprise to many of you. So first is vaccination, and especially the patient's vaccination status. So essentially, should fully vaccinated patients be able to receive care using reduced precautions compared to unvaccinated patients? What about dentists and staff vaccination? Should this be a variable that is taken into account? And this reflects back on one of the polling questions I just posed. Open versus enclosed operatories, will a time come when we can permit dentists to go back to performing, or it will be safe for dentists to go back to performing AGPs in open operatories? There's the 99% target for airborne contaminant removal, which is part of determining fallow time. Could this target be reduced and permit dentists to potentially see more patients in a day? PPE requirements, of course, can any of these be eased? In which circumstances? Point of care testing and what impact that has, for instance, on patient screening and the care that can follow. These are some of the areas we're actively exploring. Timelines are hard to predict, of course, because the sort of biggest factor that comes next is what's going on in the environment, in particular, the public health. What are the public health indicators telling us? So are daily case counts declining or increasing? Is ICU capacity stretched? What are the current reproduction numbers? So looking at the current environment and the current public health indicators, or some of them anyway, these are figures taken from the OMA dashboard that provide, I think, from a certain perspective, some cause for optimism. So firstly, the vaccination rate is high, with about 80% of eligible Ontarians being fully vaccinated, which would seem to be a game changer for the course of this virus. And you can also see, looking at the right hand of the graph, a somewhat sustained period of low daily cases. There's some sort of shallow peaks between June and present time, but they don't have the amplitude associated with the second and third wave. So this could be an indication of sort of a new normal in terms of the ebb and flow of transmission. At the same time, though, we can see that we're clearly currently on an upward trend, and it's really not possible at this point to say what this curve could look like going beyond the boundaries of the chart. And of course, this new variant is a major source of uncertainty, and it's going to be at least a few weeks, if not longer, before a clearer picture begins to emerge of this new variant and how it might change the course of the pandemic going forward. So, as we consider the impact of the environment on the course of our guidance, it continues to be the case that there's quite a significant degree of uncertainty concerning what comes next, and it puts us in a challenging position in terms of setting reasonable and proportional and sustainable precautions for the provision of care. And given that time is getting away from me a bit here, I'll move on to my final slide as a bit of a wrap up. I'll just conclude with a few key messages. And again, this is in some ways an attempt to respond to the questions that were submitted ahead of this session. I think we can expect reduction of precautions to occur gradually rather than all at once. I think the when we can expect precautions to ease is dependent on a whole variety of factors, many of which I've highlighted in my comments. The big one at the present time is where the public health indicators go next, particularly with the emergence of the new variant. And lastly, I'd leave this as a question to consider rather than a statement or a prediction. Should dentistry go back to pre-COVID infection prevention and control protocols? Even in a time when COVID is no longer an ongoing threat, the possibility of future pandemics is always present. And so should there be a permanent shift in the approach to infection prevention control in dentistry? So I'll leave it there. Thanks so much again for the opportunity to speak tonight. I hope it's not the last time.
Thank you very much, Cameron. And also thanks to Mike Gardner. I know he didn't provide the presentation, but Mike has certainly been involved quite heavily behind the scenes in all of the work that we have done related to COVID, the COVID guidance document. I just want to remind everybody that the college has a practice advisory service, and it's always available by phone or email to answer any of your practice questions. So this is obviously an event where it's really hard to have that kind of engagement that we might have face-to-face, but if you have any continued questions, please utilize the practice advisory service. It's a great resource for all dentists in the province. And I believe we've provided the practice advisory email to you in the chat, or it will be available to you following the meeting. Thanks to everybody also for providing some demographic information before the meeting. There will be a slide that will come up, and you'll see that we have a pretty diverse group from across Ontario tonight. We have mostly general dentists, but we do have some specialists represented. Many of you are from the Greater Toronto area, and many of you have more than 20 years of experience. And this is really helpful data for us because it allows us to look at who might be missing. And really, so we can focus on future events, RCDSO Connect events, and try to highlight certain groups, whether they're new graduates or individuals from northern and remote areas of Ontario. So it's really great that you provided us with that information that allows us to really think about future structures for this event. As promised, I want to take a few minutes now with Sandy to answer some of the questions that you sent to us. And not surprisingly, most of them related to the pandemic and COVID. And you've heard a lot from Cameron about our work and the potential for future work. We received more than 70 questions from you. We determined themes, and Sandy and I, over the next 15 minutes or so, will try to go through a number of those. The first is, why won't the college mandate vaccinations? Why won't the Ontario government mandate vaccinations for all oral healthcare workers? I think many of you know that the government of Ontario does not currently require healthcare workers to be vaccinated. Many healthcare employers, so hospitals, for example, have broad powers under Directive Number 6, which was issued by the Chief Medical Officer of Health in August of 2021. And Directive Number 6 requires all covered organizations, and that's a term to describe those organizations that must implement Directive 6. It requires them to have a vaccination policy, which in general terms means that all of their employees, with very few exceptions, are fully vaccinated. The RCDSO does not have the legal authority to require vaccinations for Ontario dentists, and I'm not aware of any regulatory body in Ontario that has that authority or is requiring its registrants to be vaccinated. Now, we have put out a policy statement, and that is strongly recommending that all dentists be vaccinated against COVID-19. Obviously, if the Ontario government changes their position, we will follow their direction on any mandatory direction or policy. Individual dental practices can have a workplace COVID-19 vaccination policy, and we have strongly recommended that can be consistent with Directive Number 6. And the college and the ODA have been working very closely together to provide guidance and suggestions on how you can implement and create such vaccination policies. But the decision to do so is up to individual dental offices. On the other hand, we also know that there has been a high uptake in vaccinations by both dentists and other oral healthcare providers. The second question is, if there's no mandated vaccine for oral healthcare workers, how do we navigate that terrain with our staff? Can we fire someone who refuses to get vaccinated? I think many of you know that vaccination status for COVID-19 is a pretty complex legal area. It involves human rights, personal health information, privacy, occupational health and safety, and employment law. So it's a pretty tricky area, and you have to make some determinations as an employer. And as I mentioned, vaccination for COVID-19 is not mandated currently by law in Ontario, and we know that could change. Dentists should be really careful, though, when discussing vaccination and disclosure with staff. Hopefully, many of you are already engaged in those discussions with your staff, and that you have a healthy work environment to be as open and transparent with each other as possible. But you do need to be careful about engaging in any behavior with employees that could be seen as discriminatory or workplace harassment. A dental office should obviously be a safe and inclusive environment for workers and for patients, and that includes all of your staff. And as a side note, I want to share that the college, RCDSO, as an employer of about 130 staff, requires that anyone who comes to the office must be fully vaccinated, and that includes our council and committee members. Our policy has been developed with legal input, and it can lead to termination of the individual if it is breached. So it's so important for you to get your own independent advice. We obviously received our own legal advice on that, but I've shared our approach because the college is fairly consistent with many organizations in Ontario, and there are a lot of tools available that hopefully you will be able or have already accessed. Another question is, we're encouraged to follow Directive Number 6 and ensure staff is vaccinated, or have a policy in place for COVID-19 testing. But we're also discouraged from asking staff about their vaccination status. So what should we do? Well, if you have a vaccination policy, it can be consistent with Directive Number 6, or it could have been developed with the help of your employment lawyer. You likely can ask your staff for proof of vaccination. That's part of the practices within Directive Number 6. If the employee fails to supply such proof, they either refuse to provide it or they indicate they have not been vaccinated, then the employer can trigger a number of other provisions about vaccination policy of the vaccination policy. That could include testing on a regular basis. It could include other protective measures, including education of the employee. And it can lead all the way up to a leave of absence or a termination as appropriate. Again, if you have questions on workplace policies for the vaccination of staff, the ODA has a lot of helpful information, and you can get advice from your own employment lawyers. And remember, unless you have the explicit consent of all of your staff, you cannot share their status. You may also want to reinforce with your patients and staff that using personal protective equipment and enhanced precautions is a measure that keeps patients safe. And this has obviously been done very well over the last 2 years in dental practices in Ontario and Canada and across North America. As you heard earlier, that there are really none or very few cases of documented transmission. So vaccination is an additional protection, but we all know that prior to vaccinations, dental practices were and are safe environments for patient care.
Another question was, the college has been asked whether dentists can require patients to be fully vaccinated in order to provide dental treatment, especially aerosol generating procedures. Patients should never be discriminated against or refuse treatment based on their vaccination status or refusal to disclose this information. Dentists have a duty to provide services free from discrimination. The ministry screening guidance distinguishes between patients who have and have not been fully immunized against COVID-19. Additional screening questions are required for patients who are not fully immunized against COVID-19. The protocols described in the college's COVID-19 guidance documents apply to patients based on the screening status, which includes their vaccination status, including if a patient refuses to disclose the information. Dentists must follow appropriate precautions for all patients based on the screening results for COVID-19, and these screening results determine the appropriate protocols as are described in the college's guidance document.
The next question is, why does Ontario have COVID-19 IPAC guidance that's different from other jurisdictions in North America? And how will the IPAC guidelines change now that the province is opening up? And certainly when these questions were submitted and we did hear about the province opening up, that's possibly changing now with the new variant on the scene. But again, a time will tell in terms of what impact that will have. I really want to remind everyone that we are, as RCDSO, one part of a larger system in Ontario that's designed to protect the health and well-being of patients. Responding to the pandemic involves many partners across the healthcare system, including the ODA and researchers and all levels of government, as you heard, from municipal to federal, and obviously frontline healthcare workers are a part of that system. And we must continue to follow the advice and direction of Public Health Ontario and PIDAC and the Ministry of Health and the Chief Medical Officer of Health, as you heard earlier, to ensure that our standards and our advice to both the profession and the public are coherent and consistent with those guidelines, screening guidance, criteria, and checklists. Our IPAC standard has been a model for other provinces and used by other regulators in the development of their own IPAC standards. We know that the evidence base is changing, and we are looking at how to consolidate that evidence, as you heard earlier from Cameron, and how we can use it to address patient risks and practice protocols. We're also very mindful of that environment that's shifting, and is it in the public or profession's interest to view changes right now as a reduction in precautions? And I would say that all of you have worked so hard to build trust and confidence by the public, and we really must work hard, just as hard, to ensure that policy decisions do not destroy that trust overnight, whether it's real or optics. And that's certainly a consideration that we keep in mind. The next question relates something different from the pandemic, and it relates to interprovincial licensure. What steps can the college take with the help of federal regulators to make interprovincial licensing and work easier for dentists? The RCDSO is a member of the Canadian Dental Regulatory Authorities Federation. We have continued to work throughout the pandemic with all of the regulators across the country on issues that relate to national COVID standards, specialty examinations, training program accreditation. When we think about licensure, our current timeline to start processing all applications, whether it's for those who are in Ontario or out of the province applicants, it's going to take about 2 to 3 weeks for us to really start that processing of applications. It also relies on the applicant or other third parties to provide us with documents that are required. And provided that we have these documents and no other issues are present with the application and the applicant meets the requirements and doesn't have to be considered by the registration committee for issues that might relate to conduct, the quickest possible turnaround time for licensure is really a few weeks. Now, in the spirit of transparency, we are trying to provide more concrete and updated information on our website about not only licensure requirements, but what to expect and timelines. So you will see some increasing information and enhanced information as we move forward. I also want to encourage our applicants to contact us directly. We can't solve problems by reviewing anecdotes or hearing from others who heard from somebody. So we will really help individuals understand what's happening with their certificate of registration. And that's part of a service commitment that we're making as a college to our stakeholders. Sandy.
We've also had several questions about coordinating approaches in the dental office to the COVID-19 crisis. And I'm happy to report that Ontario's oral health colleges are continuing to work together to provide consistent guidance during the pandemic. We are collaborating with the College of Dental Hygienists of Ontario, the College of Dental Technologists of Ontario, and the College of Denturists of Ontario when updating the COVID-19 guidance to provide oral health professions with clear and consistent expectations for the provision of in-person care. 6 meetings took place between April and July 2021. And as a result, the oral health colleges agreed on expectations for overlapping areas of practice. We will continue to work with other oral health regulatory colleges to create clear and consistent guidance that results in safe and high quality care for patients. Next question, is there a timeline to return to pre-pandemic practice? In short, no. We do not expect to return to a pre-pandemic practice environment anytime soon. The college itself has significantly changed working practices as a result of the pandemic. We have gone from in-office staff to a hybrid, primarily remote workforce. Like most organizations, we have adopted new policies and ways of working to fit the current environment and keep our staff, clients, and stakeholders safe. As we watch carefully, the impact of the newly identified Omicron variant will also continue to look at the evidence to ensure that practice protocols on issues like AGPs and fallow times are as consistent with the evidence as possible, given that the landscape is changing in some very uncertain ways.
Finally, we were asked about the RCDSO budget for salaries and benefits of the staff, and that obviously includes the registrar. The registrar is a member of staff. I want to be clear, and I hope you are beginning to see that there is a different level of transparency. You can find audited financial statements, as you probably could before. We've also provided on our website a chart that looks at our fees and the distribution of those fees across our various regulatory and professional liability program areas. In 2020, our operating expenses were just over $31 million, and staffing costs, that's a very significant part of that, was just about 17 million. So a little over half of our total budget. And those staffing costs include pension allocations. And this proportion is not uncommon because we're a service-based organization. We do not produce products, we provide a service. We are regularly reviewing and analyzing our compensation programs We use external consultants about every 3 years to advise us on how our compensation ranks or compares with respect to other similar organizations that would be not-for-profit or regulatory in the Greater Toronto Area. The bottom line is our staff are paid at rates that are consistent with the median of other comparable organizations in Ontario. In short, we pay about the middle of the market. We're committed to hiring and keeping good staff. We also know that it costs more to have to continually recruit, hire, and train new staff. And we know that we compete for staff with other regulators. And if we don't make decisions to stabilize our human resource practices and provide a competitive workplace environment, then the things that are important, like the regulatory responsibilities and the things that I know you care about, like timelines for complaint investigations, will be affected. I'd also emphasize that, as I've mentioned a couple of times, that the service experience that you have matters to us. And we are getting more data from you in different ways, including the annual renewal survey that I mentioned earlier, which has 4 or 5 questions to ask you about your recent interactions with the college. So I thank you again for all of these questions. Going forward, it's extremely helpful for us to know what's on your mind so we can address areas of concern. And I hope you can see from this evening that we're very interested in what you think. And those polling questions and your responses are going to be very helpful for us. So when we asked how long you thought these RCDSO Connect sessions should last, the overwhelming response was not more than an hour. So we have managed to go about 5 minutes more than the hour. So I apologize for that. But with that in mind, we're going to wrap up for the evening. And first, let me thank all of you for attending. We were so pleased that our 500 places were filled very quickly. And in the future, we hope to have sessions that are focused, as I said earlier, on particular groups. And we'd like to address particular concerns of all parts of the profession. Those who are trained here in Canada, those who are internationally trained, and thinking about students and regional representation as well. We want to make sure that the GTA doesn't get the lion's share of attention, but I know obviously it has the most volume of dentists in Ontario, but we do want to make sure that we are distributing this content to a much wider audience.
We will be sending you an evaluation survey on this evening's session. It will be very short, but it will help us to understand how to improve and make RCDSO Connect more valuable. I am personally grateful that so many of my colleagues attended this evening. Once upon a time, I would have the chance to meet a handful of you at a district society meeting or two. But the pandemic has encouraged us to get much better at online meetings, and there is no doubt it is an effective way to reach a much larger number of people with consistent information. Special thanks to the RCDSO staff in the background who have been keeping the tech side running.
Please watch for the latest RCDSO newsletter that will be arriving to your inbox soon. I hope that you will take the opportunity to read it and link to some of the attachments that are provided and to get more details on what the college is doing to meet our mandate to serve the public interest.
So enjoy the rest of your evening, and thank you so much for taking part. Good night.
Thank you very much.